Hello, welcome to the Distinct OT channel. Today I'll be talking about Down syndrome. Down syndrome is a genetic condition in which a person is born with an extra copy of chromosome 21. The chromosomes carry information in units called genes, which determine how the body forms and functions. Most people have 23 pairs of chromosomes within each cell in their body, which is a total of 46. But for people with Down syndrome, as a result of the extra copy of chromosomes, they have a total of 47 chromosomes. The physical features of Down syndrome are usually present at birth and become more apparent as the baby grows. They can include features such as a flat nose bridge, almond-shaped slanted eyes that point upward, a short neck, small ears, hands and feet, widely separated first and second toes, small pinky finger that points inward towards the thumb, a single palmar crease, a tongue that tends to stick out of the mouth, poor muscle tone or loose joints, shorter than average height. People with Down syndrome may exhibit some developmental delays, cognitive and behavioral symptoms. These symptoms and their severity vary from person to person. The developmental delays may include delays in crawling, walking, speaking, learning, delays in ability to perform simple activities of daily living, such as eating independently and toilet training. A child diagnosed with Down syndrome may exhibit behavioral symptoms. This can be as a result of the child not being able to communicate their needs to you or their caregivers effectively. Behavioral symptoms may include throwing tantrums and difficulty paying attention. However, people with Down syndrome are generally happy. Some people with Down syndrome have other medical problems as well, which may include ear infections, vision problems, dental problems, being more prone to infections, obstructive sleep apnea, heart problems, thyroid abnormalities, gastrointestinal problems such as constipation, reflux, and celiac disease, challenges with social skills, communication, and repetitive behaviors. There are three types of Down syndrome with different causes, and they are trisomy 21, translocation Down syndrome, and mosaic Down syndrome. Trisomy 21 is the most common type of Down syndrome. The term trisomy means having extra copy of a chromosome. Trisomy 21 occurs when a developing fetus has 3 copies of chromosome 21 in every cell, instead of the typical 2 copies. About 95% of people with Down syndrome have trisomy 21. In this type, an extra part or a whole extra chromosome 21 is present. However, the extra chromosome is attached or translocated to a different chromosome rather than being a separate chromosome 21. This type accounts for about 3% of people with Down syndrome. Mosaic means mixture or combination. In this type, some cells have 3 copies of chromosome 21, but other cells have the typical 2 copies. People with mosaic Down syndrome may have fewer features of this condition. This type accounts for about 2% of people with Down syndrome. Prenatal screening tests assess the risk of having a child with Down syndrome rather than giving a confirmation of a diagnosis. Screening tests could be a blood test of the birthing parent's blood to look for indicators of Down syndrome. Another screening test is an ultrasound. During this imaging test, The provider will look for signs of Down syndrome. It is possible that a screening test could be normal and not show signs of Down syndrome when the condition is present. The diagnostic test during pregnancy can confirm a Down syndrome diagnosis. They usually take place after a positive screening test. Tests could include amniocentesis, chorionic villus sampling, percutaneous umbilical blood sampling. These tests can detect chromosomal changes that lead to a Down syndrome diagnosis. After a baby is born, providers look for the physical signs of Down syndrome during a physical exam. To confirm the diagnosis, the baby's provider may perform a blood test called a karyotype test. In this test, the baby's provider will remove a small blood sample to study under a microscope. They'll look for an extra 24th chromosome to diagnose the condition. There is no cure for Down syndrome, but treatment is available to help your child reach their full potential. Children born with Down syndrome lead happy and healthy lives with supportive care. Treatment and therapies can help them reach developmental milestones, gain an education, build relationships, and have successful careers. Some of the management and the treatment of Down syndrome include occupational therapy, physical therapy, speech therapy, special education programs in school, and treating other underlying medical conditions. People with Down syndrome can reach their full potential if given the opportunity to. Thank you for watching. Don't forget to click the subscribe button, click the thumbs up, and share with your loved ones. Also, you can leave a comment in the comment section. Bye. See you in my next video.